According to the Office of the National Coordinator for Health Information Technology, or HIT, HIT, or Health IT, is defined as the application of information processing involving both computer hardware and software that deals with the storage, retrieval, sharing, and the use of healthcare information, data, and knowledge for communication and decision making. What is driving the increasing levels of health technology today? Hello and welcome. This is Susan Knowles, and I'm a doctoral student attending Frontier Nursing University. Thank you for joining me for this special report on the analysis of drivers for the adoption and use of health information technology. So I ask again, what is driving health information technology today? Is it to help retain the aging nursing workforce by implementing tools that are more ergonomic? Is it so nurses' work can be more streamlined, eliminating wasted time? Or is it implementing health technology based on the evidence of improving workflow and efficiency, quality of care, and patient safety? Could the reason for implementing HIT be driven by the desire to remotely monitor patients, manage diseases better, or for the ability to mine medical records seeking answers for how to improve the quality and decrease the cost of healthcare? Maybe it's the next logical step, since everyone from children to the elderly use information technology. Patients have an expectation that their health care should be as accessible as their bank account information and obtaining the local restaurant menu. One could argue all of these concerns are driving the implementation of health information technology. When the first report of the Institute of Medicine was released in 1999, it created a media frenzy when it pronounced a discovery that as many as 98,000 deaths in hospitals every year could be attributed to medical mistakes. So it can be easily argued that patient safety is the driver for a more efficient healthcare system. A system or a non-system that functions in a decentralized and fragmented way is what contributes to the numerous medical errors, according to the IOM. The report describes a system where patients see multiple providers in different settings, all developing their own medical plan of care independently without regard or knowledge of the patient's other medical conditions, treatments, or healthcare provider plans. Things go wrong when this happens. The cost of medical mistakes was estimated by the IOM to be between $17 to $29 billion annually, and that was in 1999. Reducing the cost of medical care is an obvious driver. Medical mistakes reflect upon the quality of care delivered. Cost, quality, and safety are all drivers to improve healthcare. The IOM recommended several strategies to develop a culture of safety. The government's response to the IOM report was swift, appropriating $50 million to the Agency for Healthcare Research and Quality, or AHRQ, to support the efforts targeting the reduction of medical errors through research. The IOM's most specific recommendation that can be directly attributed to health information technology was the call to improve access to accurate and timely information, specifically decision-making information available at the bedside. The government has both the power and the purse strings to pull off this major undertaking of nationwide adoption of health information technology, which makes the government the major driver of health information technology. According to the Department of Health and Human Services, it has the critical responsibility to advance the connectivity of electronic health information and interoperability of health information technology, or HIT. According to Blumenthal, in a special report of the New England Journal of Medicine in 2011, he cites that the government has the remedies to ensure nationwide adoption of health information technology. Blumenthal held the position of National Coordinator for Healthcare Technology between April of 2009 till April of 2011. According to the Office of the National Coordinator website, it states that the government is involved because health IT supports cost-effective ways to improve the quality of care. The government's role in healthcare IT includes encouraging adoption, supporting information privacy, supporting research on the appropriate use of IT, health IT, and using health IT systems in government-related hospitals. Information technology is commonplace in all aspects of American life, yet healthcare technology lags behind. Unlike other areas of business that put dollars into technology early, the healthcare system continues working in a paper-based, isolated world. Some facilities still remain in transition, straddling the technology divide with one foot in technology while keeping the other foot in paper. This practice leads to nursing frustration from duplication in workload, specifically duplicate charting, which is just one example that can lead to healthcare mistakes and increased costs. Since the United States has the most expensive healthcare in the world, Blumenthal stated that the country should take full advantage of the most significant technological advancements in society today and follow the lead of other industrialized nations that have adopted widespread electronic health records. One only needs to go to the Health and Human Services website to realize that studies by the Agency for Healthcare Research and Quality, or AHRQ, have been funded and ongoing for over 35 years. Many funded research projects have examined the issues of how to improve patient safety, decrease medical errors, improve efficiency, and control costs by decreasing the waste in the U.S. healthcare system. The specific healthcare solutions being examined are in the area of healthcare technology, specifically clinical decision-making, electronic health records, and the prevention of medication errors. In his two-part special report, Dr. Blumenthal in 2011 outlined two major arguments for government intervention into health information technology. And he cited a conviction that health information technology can improve health and outlined the government's remedies to solve the other problems that were inhibiting national HIT adoption. According to Blumenthal, without government involvement, digitalizing U.S. health information would not occur. President G.W. Bush first established the Office of National Coordinator for Healthcare Technology in 2004, and funding from the Department of Health and Human Services began in 2005 with the establishment of the Health Information Technology Standards Panel, and that continues today. In February of 2009, Congress, in an attempt to ward off an economic recession, passed the American Recovery and Reinvestment Act, or ARRA. As a part of the Recovery Act, Congress took full advantage of the situation and also passed the Health Information Technology for Economic and Clinical Health Act, or Hitech, to encourage both healthcare facilities and providers to adopt health information technology. With the passage of the Hitech Act, $29 billion were now allocated to promote the adoption of EHR, or health information records. And specifically, $19 billion were targeted as incentives to drive the adoption of health information technology by providers and healthcare facilities if they took the necessary steps to be meaningful users of the technology. As a major driver of health information technology, the government adopted policies to encourage and penalize providers and healthcare facilities into adopting electronic health records through the Meaningful Use program. In 2008, before the Hitech Act passed, only 17% of physicians and 12% of hospitals had electronic records, and that's according to the Office of the National Coordinator, and at the time, Dr. Blumenthal. The Hitech Act's primary purpose is to have providers and healthcare facilities adopt and use health information technology, specifically electronic health records, with an ultimate goal of a national health information network. The goals of this act are to improve information sharing of medical records in an effort to eliminate waste and improve quality of patient care. To operationalize widespread adoption of health information technology, one of the most powerful initiatives has been the Hitech Act. Through this act, the Department of Health and Human Services enacted two incentivizing regulations for adoption of HIT, meaningful use and certification of electronic health record systems. Only providers or healthcare facilities that care for Medicaid or Medicare beneficiaries are eligible for incentive funding. The goal of the Meaningful Use regulation is to encourage widespread adoption of EHRs, improving the management of patient-related data, improve the quality of care delivered, and manage healthcare costs. The certification of electronic health record systems regulation describes standards that must be met in order for the user to collect payments and to help providers to obtain the technology that will aid them in fulfilling meaningful use. The Office of the National Coordinator also launched $2 billion of programs to assist providers with adopting electronic health records in 2010. According to Judy Murphy, who is a member of the Federal Health Information Technology Standards Committee, the criteria to meet the meaningful use of EHRs is divided into three stages. The first stage began with the data capture and sharing between 2011 and 2012. Stage 2 is scheduled to begin this year in 2014, and it's building on stage 1 with advanced clinical processes to improve the quality of care at the point of care and electronic exchange of information. And finally, stage 3 will be building on stage 2 and will focus on improving outcomes in quality, safety, and efficiency, as well as clinical decision support and patient self-management tools. Stage 3 is scheduled to begin in 2016. Meaningful use is broken down into 5 umbrella type initiatives that are further defined by specific objectives or clinical quality indicators that providers must demonstrate and report annually to be in compliance. The 5 overarching initiatives are to improve quality, safety, and efficiency and reduce health disparities, engage patients and families, improve care coordination, improve population and public health, ensure adequate privacy and security protections for personal health information. The government's purpose in providing incentives to adopt electronic health records comes with an overarching goal. Just having digital health records is not enough, according to Blumenthal. He says